I'm Saraya Mia, and this is AWANI Tonight. How important is mass testing towards detecting silent carriers of COVID-19? And Malaysia named one of the most worried countries in regards to COVID-19. What drives this? That's coming up. Malaysia's COVID-19 infections dropped below 6,000 for the first time in weeks, recording 5,271 new cases today. However, the country reported 82 new deaths from COVID and a total of 902 active cases in the intensive care unit, with 447 needing oxygen assistance. Selangor is still the state with the most cases at 1,374, followed by Sarawak with 703 cases, Negeri Sembilan 571, and Kuala Lumpur 455 cases. Meanwhile, the nation's COVID-19 infectivity rate, or R0, fell to 0.99 on June 6, the first time it has declined below 1.0 since April. According to recent data shared by Health Director General Tan Sri Dr. Nur Hisham Abdullah, the R0 has showed a decline in the past week. Starting tomorrow, the police will only accept approval letters issued by 6 ministries and certain agencies in allowing workers to pass through roadblocks. Those who fail to do so or found using a fake letter will be subjected to stern action. The ministries involved are the Ministry of International Trade and Industry MITI, Ministry of Transport Malaysia MOT, Ministry of Agriculture and Food Industry MAFI, Plantation Industries and Commodities Ministry, and Communications and Multimedia Ministry. Meanwhile, all approval letters issued by agencies under the Home Ministries such as the Immigration Department, National Registration Department and RELA will be accepted for movement purposes. Approval documents need to be dated June 1st, 2021, and those without any legal documents or possessing expired or outdated letters will be ordered to turn back. Since launching a free mass COVID-19 screening scheme in early May, Selangor has consistently been the state with the highest number of daily cases. However, health experts lauded the initiative as a constructive step towards combating the pandemic, especially in detecting silent carriers of the virus. Here to talk about the initiative is Selangor Task Force Operations Director, Assistant Professor Dr. Muhammad Farhan Rusli.
We are trying to identify the silent carriers. So the silent carriers are what we call asymptomatic patients. So these are patients who are perhaps well, healthy, but they are actually COVID positive and they do not know that they are COVID positive. So perhaps people never had a chance to actually go through a COVID testing, since we found out that a lot of people who actually come and do this mass testing have never actually gone for a COVID testing before. And these are people who are actually in the hotspot areas. And this is worrying because what we fear that these asymptomatic patients would actually go home or to their families and infect people who are vulnerable, such as their parents or their grandparents, who may end up being in the ICU. So that's the reason why we do a statewide blanket mass testing, so that we give an opportunity for the people in Selangor to actually get themselves tested. And if they are positive, they get to isolate and quarantine themselves early. And this in turn actually reduces the burden on the healthcare system and reduces the number of cases that may stem from these people who are actually asymptomatic carriers.
Dr. Farhan says access to affordable testing is crucial and called for a ceiling price to be imposed on RTK antigen test kits to allow people to test regularly. Selangor residents in all 56 states constituencies can still undergo free antigen rapid test screening until June 10th under the free mass COVID-19 screening scheme.
As of the 42 dons that has been done, we have conducted almost 86,000 RTK-AGs, and it has been, the response has been overwhelming from the people. This is generally because I think a lot of people do not have access to actually testing because the prices in the private areas might be actually a bit expensive. Another aspect is that because of the cost, where we've had a family of 7 who come and tested. They said that they almost saved 1,000 ringgit because if they were to go to a private clinic, it would have costed them 120, 150. And that's one of the reasons why we from Selangor are pushing for the federal government to actually give out or actually order a blanket or a ceiling pricing on RTK-AG testing, because people need to have access to cheap, reliable testing, and people need to get tested regularly.
Dr. Farhan says it is time for the Rakyat to demand from their respective state governments for COVID-19 mass testing. This is the best way to detect silent carriers and limit sporadic cases.
We have had a lot of questions where they have actually asked us, what are you doing actually in Selangor? How come Selangor records the highest number of cases? Are you guys not doing your job? While the question should be them asking their respective state governments, if Selangor is so high, how come other states are so low? There must be a reason, and the reason is very simple, because Selangor is testing and testing and testing. The more we test, the more we find. We are not afraid of having high numbers of COVID cases. What we're more worried about is that we want to find them, we want to isolate them early, and I implore all other states in Malaysia to actually be doing the same thing. You need to find out who are your asymptomatic positive cases. These are your silent carriers. These are people who will actually wreak havoc in your system. And if you don't do the proactive method of actually doing mass testing, you will never get out of this pandemic. So people should demand from their state, should be asking their state and relevant authorities, how come they do not have access to free mass testing? And this should be the question that should be asked by everyone else.
We'll take a short break. Stay with us.
Self-control, self-lockdown tu penting. Lebih kurang pergerakan, maka lebih sukar untuk COVID menjangkit kita.
Untuk tempoh 2 minggu ini, duduk di rumah. Kalau kita boleh laksanakan KKP, kendiri dan keluarga,
Welcome back. Malaysians' concern about COVID-19 has been high throughout 2021. However, since the recent resurgence of cases in the country, Malaysians are in fact one of the top most worried countries when it comes to COVID as compared to other nations involved in a survey by Ipsos. With that statistics, how do we make sense of the data? Here's what Ipsos Associate Director of Public Affairs, Lars Eric Lee, has to say about the data. The survey conducted among 28 other countries showed that Malaysians, among others, had the highest concern in the month of May at 74%. This is even higher than China, South Korea, and even India.
I think the main challenge that all the countries are dealing with is complacency, right? For countries that have been dealing with a pandemic, when people become complacent, you can basically have a resurgence anywhere, anytime, even with a very good track record.
According to Lars, this was driven by inconsistent lockdowns that may have led to pandemic fatigue and complacency.
We have a wave of COVID, it starts to recede. People can start going back to their daily life to some extent, obviously. And then we have a new wave. So I think that start and stop, it's kind of a fatigue that sets in, right? So when you always have to kind of start all over again, then I think it's easy to kind of get tired of it and also get complacent. We also see from our data that the countries that have come very far in their vaccinations, high level of vaccinations, of course they have fewer COVID cases, and we also see that the concern about COVID is dropping significantly. So luckily, I mean, vaccination have been picking up very well in Malaysia as well. So I think the most important thing is that we continue doing what we need to do, follow the SOP, social distancing, and of course getting a vaccination when we have the chance.
On the international front, Thailand kicked off its long-awaited mass vaccination campaign as the country battles its third and worst wave from the pandemic. It aims to administer 6 million doses of locally made AstraZeneca and imported Sinovac vaccines this month in hopes to reduce the worries of a slow rollout and supply shortages. Prime Minister Prayut Chan-o-cha said the Health Ministry confirmed that vaccinations could begin in every province, with vaccines being allocated in accordance to the infection rates. He said they have 3 days' supply on hand, but he did not know if other sites had enough for more than 1 day. The government plans to administer about 500,000 shots per day starting today, compared with the daily average of about 100,000 over the past week, according to the Health Ministry officials. The government had come under fierce criticism of failure to secure timely and sufficient vaccine supplies. Thailand last year had been considered a success story in containing the spread of the virus. However, a third wave of infections beginning in April has accounted for 84% of the 179,886 confirmed cases in the country since January last year, signaling the need for a more ambitious vaccination campaign. As of Saturday, Thailand had given 4.22 million vaccinations, with about 4% of the country's 70 million people receiving at least one jab. 100 former presidents, prime ministers and foreign ministers have urged the Group of Seven, or G7 nations, to pay for global COVID-19 vaccinations in order to stop the threat of the virus. The appeal was made ahead of the G7 summit in England, which begins this Friday. Among the signatories were former British premiers Gordon Brown and Tony Blair, former UN Secretary General Ban Ki-moon, and 15 former African leaders. In their letter, the former world leaders claimed that the support from the G7 and G20 that makes vaccines readily accessible to low and middle income countries is not an act of charity, but rather is in every country's strategic interests. They said that the G7 and other leaders invited to the summit should guarantee to pay what would amount to about $30 billion a year over 2 years towards fighting the pandemic worldwide. 2 express trains collided in southern Pakistan earlier today, killing at least 40 passengers. Rescuers and villagers are still working to pull injured people and more bodies from the wreckage. The Millat Express derailed and the Surside Express train hit it soon afterward. It was not immediately clear what caused the derailment and the subsequent collision. Railway officials say about 1,100 passengers were on board the 2 trains. Officials at Pakistan Railways say they had ordered an investigation and rescue work was still in progress. After a long battle with COVID-19 restrictions, Spain opens its borders to vaccinated travelers from all over the world today. The country hopes an influx of visitors will revitalize its all-important tourism sector, which has been battered by the pandemic. Spain is a safe destination, Health Minister Carolina Darias insisted, adding that the country was in the process of reclaiming its global leadership in tourism. Spain was one of the Western economies worst hit by the pandemic, seeing a 10.8% fall in its GDP in 2020. After months of closure, restaurants are reopening while airlines have restarted routes dropped during the height of the pandemic. Malaga Airport was expecting around 20 different flights on Monday morning alone from places around Europe such as Berlin, Lille, Frankfurt and London. Meanwhile, non-vaccinated Europeans who can currently enter Spain with a negative PCR test taken within 72 hours will from Monday be able to take a cheaper antigen test instead. Amounting to 5 billion ringgit in direct fiscal transfers, what impact can Pemerkasa Plus have? Tonight on Consider This, we ask economists about the thinking behind the latest government economic support measures. This is all we have for you on AWANI tonight. Get the latest news updates on COVID-19 and COVID-19 vaccines from astroawani.com and Astro AWANI app. I'm Saraya Mia. We'll see you again.